Hello and welcome to this podcast for the journal Neurogastroenterology Motility, entitled Looking Back, Moving Forward. My name is Dr Mohsin Butt and I'm the trainee editor for the journal, based in the Department of Gastroenterology at the University of Nottingham. I'm delighted to be joined by Professor Maura Corsetti, the outgoing editor-in-chief, whose leadership has shaped the journal over recent years, and Professor Daniel Keszthelyi, who is stepping into the role as incoming editor-in-chief. Today is a particularly meaningful conversation as we mark a transition in editorial leadership and reflect on where our journal, as well as the field of neurogastroenterology more broadly, has been and where it is going. As I'm sure you're all aware, Professor Corsetti is based at the University of Nottingham and is an international expert in the field of neurogastroenterology. Among her many achievements, she is co-chair of the Rome 5 Bowel Disorders Committee and steered this journal between 2023 to 2026. Professor Daniel Keszthelyi, our incoming editor-in-chief, is head of gastroenterology and hepatology at Maastricht University Medical Center, which is also where he obtained his PhD and completed higher specialist training in gastroenterology. In addition to being a fellow of the Rome Foundation, a few of his career highlights include being a past recipient of the United European Gastroenterology Rising Star Award, the Rome Foundation International Research Award, and the European Research Council Starting Grant. He has previously acted as associate editor of United European Gastroenterology Journal, a role in which he, according to a post by former editor-in-chief Drew Strength, brought, I quote, trademark clarity, wit, and sharp scientific thinking, and additionally as media editor of Neurogastroenterology Motility. As the incoming editor-in-chief, he brings a strong vision for methodological quality and innovation in a rapidly changing scientific and publishing landscape. And we wish to discuss this all today. Maura and Daniel, thank you so much for joining me.
Thank you for inviting me.
To begin with, Maura, we'll start with you, looking back at your time as editor-in-chief of the journal. Do you mind describing the items that you're most proud of achieving in the 3 years that you were editor-in-chief?
Yes, of course. So I want to say that I started working for the journal in 2016, and then I was appointed as editor-in-chief in 2023. So I had some experience with the journal before, and this was definitely helpful. I think that the things that I'm most proud of are definitely the team that I created, because I think that when I was appointed, I wanted to have, the people that I consider the best in the field, that they could cover every part of the field of neurogastroenterology and motility. And one of the things that I really wanted when I was appointed was to kind of improve the methodological strength of the journal. So I noticed during my experience as an editor that we were lacking some support for the statistical analysis sometimes, because of course this kind of field is evolving. So there are new methods to do statistical analysis of papers that are becoming more difficult. So we needed to have someone with this expertise, and this is why we appointed Mike Jones from Australia. Then also we were lacking with some expertise for the systematic review and meta-analysis, because we were receiving this, but we were not good enough in really evaluating the scientific strength of this kind of publication. So this was something that I really wanted to improve in our journal. And then of course, the idea that we had to appoint some trainee editors was also a very good idea, because we changed completely. Working with the younger people made a lot of difference in our team, because we had fresh air, people that were really looking at the things in a different way. So I think that this was one of the things that I'm most proud of. And also the things that we decided to start this idea of awarding the best clinical manuscript, the best basic science, and the best translational manuscript, because I think that we need to really also in some way reward the authors and the people that are sending the manuscript to us, and also the reviewers, because of course in selecting these papers is the work that the tremendous work that our reviewers are doing, and over the years we are now stretching them even more, because of course we are requesting more and more reviews, is something that I totally think was something that we needed to consider. Yeah.
Mm. Thank you, Maura. And you mentioned some of the highlights, but what were the challenges that you faced over the past 3 years?
So I have to say that probably because I'm a very positive person, I tend to really don't remember so much the challenges that I had to really take during my appointment. I have to say that of course there have been some difficult moments where we probably touch some controversial topic that I was really probably not expecting to have to deal well at that level, but I think that this was something that brings always something, and you learn something from everything. And I think that the other things were really that when I was appointed, there were no really so structured procedure for example, inviting guidelines and clinical practice update, and also we had to revise a little bit the instruction to the authors, because we noticed that most of the papers that were coming to Neurogastro really were not following the normal structure of, for example, reporting the sample size calculation, this kind of things that seems to be simple, but are really the things that makes a manuscript completely different. So I think that these were some of the challenges, if we want to call challenges, but that is a kind of normal kind of work that you need to do when you are in charge of any kind of new role, I think.
Sure. And I guess the next question ties into the first question in a similar sort of vein. So how did you see the journal's identity evolve over the past 3 years? And again, this might tie into the things that you're most proud of achieving in the 3 years.
Yeah, I would not say that the identity changes so much. I think that I'm really happy to see that this journal is still seen as the home for all the news in the field of neurogastroenterology and motility. And of course, this is also the other thing that we need to balance. Being the official journal of the European and American Society of Neurogastroenterology and Motility, we cannot really be like the other journal that we just look at the impact factor, but we need to make sure that we really publish the things that are really going to improve our field. And so I think that this put us in a more difficult situation as compared to other journals. So I think that the journal is evolving in a way, being probably methodologically more strict in some aspects, and I'm expecting this probably to further improve under Daniel. And I think that this is just a positive thing, because is what we need for our field, because otherwise we will still be considered as a field where we publish not so scientifically strong manuscript on research. And I think that this is not true, and we need to really do whatever we can to really change this perspective, I think.
And did you notice there were any shifts in the type of questions that researchers are asking, or the methods that they were using over that you saw in the 3 years?
Well, not really. I think that what I notice is that the quality has definitely improved, so that now the manuscripts that are coming to us are more frequently papers that really deserve review and deserve to be published in most of the cases. So this is the things that I notice most as compared to when I started in 2016. Probably there was still some, this is the main difference that I think I notice in my under my point.
And you briefly mentioned Daniel's name. So what excites you most about Daniel taking on this role as the incoming editor-in-chief?
So, well, I know Daniel since many years, and I always estimated him a lot because I think that he's an excellent scientist, an excellent clinician, and he has also this background as a basic scientist that I think would be really useful for the journal, so that he has this ability to really judge both of the two fields. And I really think that he has this scientific mind and is a serious methodology. So I think that this will bring only good to the journal. So I'm very happy that he accepted to take over this role.
Thanks, Maura, and thank you for all the work that you've done over, since starting in this journal, which is what, a decade now, right? Since
Yeah.
2016. So very impressive work. So thank you very much. And moving to Daniel though now. So Daniel is a what excites you most about coming in as editor-in-chief of the journal?
Well, first of all, thank you all for the flattery from both of you. I'm not sure I entirely deserve of it, um, but I feel very privileged to be taking on this position. And Maura obviously has done an excellent job, and also the editor chiefs in the past, like Steve Benner, and before him. So there's a big legacy that I need to fulfill, and we are all very fond of this journal. I mean, anybody who is within the field of neurogastroenterology motility has a very strong connection to the journal. And I know this from the fact that, when I started as a PhD student, this feeling starts from whatever starting point in your career. And I'm very happy that I can contribute to this from within this new role. So I do feel very excited that I get to be in the forefront together with the new team, as guiding this area of still very exciting research. So even if you've been in this area for 20 or 30 years, etc., there's still so many things that you can research, you can look into, and that makes it very exciting. So I'm very happy to take on this new role.
Mm, sure. And how do you see your role differing then from or rather building upon the foundations that have been laid down by Maura and her predecessors?
Yes, so Mara and her team, which I have also had the privilege of being part of. I think we did a good job in making a number of important steps, and Mara already alluded to these. So one of them is the trainee editorship, which you are also a part of this team. So that's really exciting because it brings new energy. The other thing is the instructions that we now have developed for guidelines and critical practice updates from both the societies and the journal management committee. I think this is going to be very helpful for us to bring some more clarity as to how this is going to work out. And in the end effect, that is going to be very helpful for the journal, because these are generally the papers that attract a lot of impact and attention. So I think that having this framework is really very good. And we will be implementing this from this point on, and we will communicate this broadly within a short period when all the dots have been placed at the right place. And so I'm very confident that that's going to be the legacy of the outgoing team that we will be carrying on.
Mm. So you mentioned clinical practice updates, guidelines. What kind of papers in particular, in addition to those, do you feel that you wish to attract to the journal as editor-in-chief? Or are there any types of papers that immediately signal to you that the paper definitely belongs in the journal?
Yes, so Mara already alluded to this point already. So if your paper is impactful or potentially impactful in the sense that it presents novel information, it has the potential to impact clinical or scientific practice in a fairly short period of time. That's highly interesting for the journal. And the paper can potentially be of retrospective nature in this regard, provided it gives you a very novel insight as to some kind of area that has not been looked into before, or from different angle. In general, I think that we should try to encourage prospective studies, multi-center studies, And because that's probably methodologically speaking the level of evidence that you'd want to encourage as to move forward. So obviously the field that we are in is more difficult to navigate than, for instance, other fields, IBD, oncology, where there's a lot of more opportunities for RCTs and that type of big trials. We don't have that, so we need to be mindful of that, but at the same time also be sure that there's the methodological rigor that we need to adhere to, because otherwise if we don't do that, we might end up on a path that eventually doesn't lead to any improvement, or even can have detrimental effects.
Yeah, sure. And how do you ensure that the journal then remains distinctive in an increasingly crowded publishing space?
Well, that's exactly the challenge that is to that we need to navigate through. And one of the things that we've noticed, and Maura has also mentioned this, is that there's a higher number of submissions. So that means that we need to reach out to a higher number of reviewers. So in that sense, we've also now looked into the editorial process. We've tried to simplify that in the sense that we now go to a 2-tier system instead of a 3-tier system. So that might speed up the editorial decision. And we'd want to look at faster decisions, and probably also more desk rejections, not because papers do not necessarily or should not be reviewed externally, but also if we have the impression that in the end effect this is not going to meet that standard that we're looking for, and then we don't want to overburden our reviewers either. So that could be a trade-off to make sure that we have fast decisions, but just decisions, obviously, and to make sure that we get the best of the best possible for our field.
Mm. So you mentioned a few of the things that you wish to do over your tenure, but if we were to have this conversation in 2029, what would success look like for you then?
Yeah, so one of the things that I'd like to put some more effort into is broadening our reach beyond merely the scientific community. So I have the impression, and I do feel that this is also something that's happening in the UK as well, is that patients themselves are far more interested in scientific projects, scientific research papers, etc. So I oftentimes have people who come to see me in clinic with a PubMed list of papers that they have identified. So I think that is something that we should embrace, and we should engage in this type of dialogue. So I would want to see if we can also move to a more patient-centered way of presenting research. So I'm also already looking into a plain language summary that we can publish with all the articles presented, whether it's a basic science article or otherwise, so that we can have this reach among the public and also patients. And particularly because we are still a subscription only journal, unless you have the open access option as an author, because not everybody might have the funds to actually achieve that. So I would want to see this as a way of increasing our impact, not necessarily in the scientific sense, but more in the public sense. And I think this is also what funding bodies and governments are also very much looking into. And the same goes for some matters related to the content, to really the scientific content. I would want to facilitate discussions between doctors and patients, or healthcare professionals and patients, and the public in more broader sense, to look into like a research agenda or a list of priorities that we'd want to look into from both point of views.
Mm. So you talked about research priorities, Daniel. I'm actually going to pose a question to the two of you now. So are there any, do you have any ideas about where motility is heading as a discipline, with regards to mechanisms, technology, methodology? What are the research priorities going forward, do you feel, in this field, to the two of you?
Yeah. So yes, that's I think a very interesting point. And what my impression is that we need to move towards a better phenotyping and stratification of patients on the basis of their of the underlying mechanism, the primary underlying mechanism that can be targeted ideally. So many of the diagnostic categories that we have right now are fairly descriptive in nature. So if you think of functional dyspepsia or irritable bowel syndrome, those are very descriptive terms. And I have the impression also that both patients and doctors sometimes have difficulty with dealing with the fact that we don't have these, you know, biomarkers or phenotyping tools. And I don't have the impression that we will have one single biomarker for functional dyspepsia or whatever disease, but that we should look into, you know, different types of trying to gather all this information to characterize the individual patient to determine what is the best course of action. I think there's a very great need from both sides in this regard.
Mm. And
Yeah,
Maura?
and just to add on this, I totally agree with Daniel, and I think that also seeing what attracted mostly our readership over the last years is also the new technology. So I think that I'm really excited by the fact that we have now access to non-invasive technique that probably will be able in the future to really determine better and study better the function of the GI tract in all the different aspects. And so I'm pretty sure that probably this will help to really phenotype better our patient. It's still probably a long process, but I see some positive signs from these last years. So yeah.
Mm. And the two of you also mentioned about trainee editors. And I'm just curious, in addition to that, do you feel we're training the next generation well enough to enter into this field? And what can the journal do better?
So definitely not. I think that we can do better. And as Mohsin knows, I'm really interested in this part in really improving the training of the young generation of researcher and also of clinician. And I think that in this the journal can do a lot. Probably teaching how to write a manuscript from the beginning. And also how to assess the scientific papers just to make them prepare to really their work then. And I don't know if Daniel has some idea also on this.
Yeah, sure. So Mara and I oftentimes agree with each other. So I think this is also true for this specific podcast. And maybe, you know, I'm not sure whether there could also be a role for the journal as far as, for instance, communication techniques is concerned. And obviously, the journal is not going to teach you how to communicate, but by sharing, you know, best practices or sharing some experience with each other, and ideally also in a scientific context to actually you know, show that doing this way improves your patient contact or whatever. So I think that would be very nice to have that kind of content also for the journal.
Sure. And my final question then, posed to Daniel. So, as incoming editor-in-chief, so some of our listeners will be authors, reviewers, readers. And what final message do you wish to send to these individuals?
Yes, so I would just like to say that we as a neurogastro community, we are a fairly small family, even globally speaking, and we all foster this community and the journal, which is the most important conduit of this community. So that's what I'd like to embrace, is this feeling of community, in that the journal acts as a conduit and everybody contributes to that, as an author, as a peer reviewer, as editors ourselves indeed. And I think that's the most wonderful thing that we can do, is because we're doing this together.
Mm. Thank you, Daniel, and thank you both for such an insightful discussion. I think we can all agree that this feels less like a handover and more like a continuation of a shared vision for the field. So thank you so much, Daniel and Maura, for your time.
Thank you.
Thank you very much.